I am really sobered and saddened that in our county here in Montgomery County, we don't have the access that we need to healthcare for our trans community. And in fact, one of the reports has members of our community talking about Montgomery County as a desert when it comes to healthcare for our trans community.
Montgomery County Council Vice President Kate Stewart joined a Transgender Health Care Roundtable to discuss the results of a community survey and report, which revealed the barriers and limitations that the LGBTQ+ and transgender community face in the healthcare sector of Montgomery County.
Today, we are joining in partnership with CCI, one of our health clinics here in our community that provide wonderful services. And we're having a panel discussion to talk about the two reports we have now and the need for trans health care and our plans moving forward in the county.
The report done by the Montgomery County Office of Legislative Oversight found that transgender individuals are more likely to experience fair or poor health and have higher rates of serious psychological distress when compared with cisgender people.
I started out with a lack of access to healthcare, and I ended up getting my healthcare in Washington, D.C., which I feel like is reflective. If I'm one of the transgender leaders in our community and I'm leaving my county to get healthcare, that kind of underwrites the basic lack of access to this care.
I spend a lot of time, because I am medically transitioning, in Baltimore, which I think is ridiculous. I'm so happy that I have the privilege to be able to travel to Baltimore to get all of the health care that I need. And I am so disappointed that people who don't have transportation or wealth are that they're not able to receive care in their community.
The survey conducted by the Montgomery County's Department of Health and Human Services and the LGBTQT Advisory Board found that 41% of transgender people needing trans-affirming care reported difficulty finding it in the county.
We need to work on changing hearts and minds, and that looks like a lot of things. And one of the ways that looks is like the OLO report suggested that doctors get training and that there's a safe space for trans folks in the case of OLO report, but in general, a safe space for LGBTQIA+ people in Montgomery County.
According to the report, transgender people also report significant rates of coverage denial for transgender healthcare services.
We have a long way to go, but that CCI is a place that is committed and dedicated to creating what we call safe, affirming environments. So regardless of your ability to pay, regardless of how you identify, that coming to CCI, you can access full spectrum preventative and primary care.
As the Secretary of Health, I work for Governor Moore, and Governor Moore has been very clear from the beginning, leave no Marylander behind, and that's inclusive of the transgender community. And from the beginning, during last year's General Assembly, he signed an executive order that had a whole menu of rights and healthcare access services that we're trying to protect. And then under Medicaid, which sits under the Health Department, we have expanded access to care and coverage of transgender healthcare services.
For members of our transgender community, I will say that we see you. We know the barriers you are currently facing for your healthcare needs, and we want to work with you to make sure that we address those needs.
In Montgomery County, Maryland, Marcela Rodriguez Villagran.